Today we're going to be talking about, I just finished a consultation and it's still fresh in my head, and we're going to be talking about the top 20 questions a cosmetic physician gets asked during consultation. Today I had a patient who's in her late 50s. She hasn't done any cosmetic procedure and she wanted to look rejuvenated. And she was asking me, because we're running a promotion on Thermage and Authera, should she be doing Authera or Thermage? I looked at her face. Each individual patient age differently because your bone structure is different, your soft tissue structure is different, your extent of volume loss is different, and your genetics are different. So things that is suitable for one person to get younger looking might not be suitable for other person. Take Thermage and Authera for example. Thermage and Authera would make you look youthful. I do it like almost twice a year to help my skin get tighter. But for a lot of people who has a lot of volume loss, especially at the age of 50 or 60s, sometimes it might not be the best first route to go. Why? Because you're spending that much money for this amount of value. At that point, you probably want to do something that would be spending that much money but give you this amount of value. It's like always what I said, increase your beauty score by 80% instead of by 20%. So what are those cosmetic procedures that can help you look much younger in a relatively short period of time, as well as having less recovery time? It's so individualized depending on how your face structure looks like. For example, for this patient, I probably would start with injections because her main issue for aged looking is because she has a lot of indentations that are not supposed to be there. The tear trough, the nasolabial folds, and the indentation of the marionette lines all look downwards, right? So visually she looks aged, but is her skin really saggy? Not necessarily. So when we restore these areas for the patient, it immediately recharges the patient and make them look younger immediately. But if we did Thermage or Authera on this patient, even after 6 months, the patient might not be as satisfied as having these areas using correct filler to fill up. But let's say for this patient also has a concern of looking aged. I think the patient already look very good. It's just the skin is a little bit saggy. She doesn't have the obvious signs of 3 lines that's making her face look droopy. It's just the skin texture is a little bit saggy. So at this time, we definitely need it to be a little bit toned up and make it tighter and thus look younger. So for this patient, I would probably start initially with some machine therapies like Thermage, Authera, Forma, Alice, or even like a Genius, you name it. We can help to tighten up the skin. So getting younger as well as getting your face rejuvenated back to 5 years or 10 years ago is so unique to each individual patient, and you need a customized consultation with your cosmetic physician to see what is best for you and what can give you the best desired results. I'll see you next session. Our next session, we're going to start to answer the 20 questions a cosmetic physician gets commonly asked.